Hi, I'm Joe Giacino. I'm a professor of physical medicine and rehabilitation at Harvard Medical School and director of rehabilitation neuropsychology at Spaulding Rehabilitation Hospital in Boston, Massachusetts. As a fellow member of the Neurocritical Care Society, I'm inviting you to participate in a federally funded study supported by the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDLR, focusing on clinical management of persons with disorders of consciousness, or DOC for short. This is an area fraught with misunderstanding, confusion, and nihilism. About 4 in 10 persons judged to be unconscious on bedside examination actually retain conscious awareness. Prognostication is often inaccurate, and life-sustaining treatment may be prematurely withdrawn. In 2018, the American Academy of Neurology, the American Congress of Rehabilitation Medicine, and NIDLR developed and published evidence-based practice guidelines to improve care for this population. To date, there have been no systematic investigations of clinical knowledge, provider attitudes or beliefs, or the extent to which these guidelines have been adopted in clinical practice. We're inviting NCS-affiliated physicians, nurse practitioners, physician assistants, nurses, psychologists, and therapists actively involved in the care of persons with DOC to complete a 20-minute online survey that addresses these themes. Those who complete the survey will receive a $30 stipend. The survey results will inform the development of DOC guideline knowledge translation, strategies, and tools that will be pilot tested for use in clinical practice in diverse hospital settings at a later phase of the project. If you're interested in participating, please scan the QR code on your screen to learn more about the study. Thanks very much for considering this.
Hi, I'm Sam. I'm originally from Boston, and I'm grateful for the opportunity to contribute during World Coma Day. I had a severe TBI in May 2011. I got hit by a car skateboarding, and I was treated at MGH in Spaulding. I think it's absolutely essential that survivors of brain injury get the most comprehensive form of care. If that's to happen, I think psychoeducation and neuroeducation really need to improve on both the side of the provider and the survivor. Individuals need a lot of support, and if they don't have that, additionally from their family or friends, then healthcare really needs to step up. I believe it's also really important to have input from people with lived experience on advisory boards like this one for disorders of consciousness that I've been able to be involved in. Lastly, I'd like to advocate for screening across mental health settings. Brain injury screening is really underutilized, and if we are to improve the inequity in brain injury outcomes, screening, education, both really need to improve. Thank you.
Hi there. I'm Dr. Hannah Steer, a physical medicine and rehabilitation physician at Massachusetts General Hospital. In my role here, I work closely with patients in the acute care setting, helping them at the beginning of their journey to recovery. As a provider champion for the Disorders of Consciousness Project, I'm hoping to tackle 2 issues I commonly see in practice. First, misdiagnosis within disorders of consciousness is alarmingly high. And second, prognostication can be imprecise. This leads to another critical issue: life-sustaining treatment for patients being discontinued prematurely. For this reason, integrating evidence-based practice guidelines into our daily routines as healthcare providers is essential, but it is not always easy. We face challenges in navigating complex medical literature and implementing guidelines effectively. That's why interdisciplinary collaboration is crucial. From physicians like myself to physical, occupational, speech therapists, nurses, NPs, PAs, psychologists, and our dedicated research team, together we can make a difference. This is why I am driven to be part of this project. It is the desire to provide the best possible care for patients. Every day, I see the impact that accurate diagnosis and prognosis can have on their lives and their families' lives. I invite you, my fellow providers, to join us in this mission. Take our survey, share your insights, and let's work together to improve evidence-based care for patients with disorders of consciousness. Thank you.